California's ambitious Care Court program was hailed as a breakthrough for mental health. But the reality is sparking fierce debate. Is this really a new start, or just another well-intentioned plan falling short? Let's unravel what's working, what isn't, and why experts and families are more divided than ever. 3 years ago, Governor Gavin Newsom stood before the public and championed Care Court, offering hope to thousands of unhoused Californians grappling with severe mental illness. He didn't mince words. Previous efforts like Laura's Law had failed to make a real dent. During the 2018-19 fiscal year, it helped just 218 people. Newsom argued that certainly is not demonstrable progress. With strong promises, he vowed Care Court would be different, more effective, more far-reaching. But here's where expectations clash with outcomes. Nearly 2 years since its implementation, Care Court has only reached a few hundred individuals, barely surpassing the program Newsom criticized. Where were the thousands it was supposed to help? In pursuit of answers, CalMatters surveyed nearly every county in California and conducted over 30 interviews. The data paints a picture of a system chugging forward slowly, with numbers and impact lagging well behind early predictions. The premise was straightforward. Family members, first responders, and medical professionals could petition courts to help people struggling with severe psychosis who couldn't care for themselves. If accepted, those individuals could pursue voluntary treatment, ranging from therapy, medication, to housing, and more. Refusal would mean a judge could mandate a treatment plan. But most counties are still offering only voluntary care agreements, which individuals can ignore. Actual court-ordered treatment plans? Only 14 have been sanctioned statewide. That's the part most people miss. The teeth of the program seem to be missing. Here's a snapshot of what's actually happened. Rather than the 7,000 to 12,000 eligible Californians projected, only 2,421 petitions had been filed as of July, with merely 528 resulting in treatment agreements or plans. In San Diego County, officials expected 1,000 petitions the first year, with 250 people getting care. Instead, over nearly 2 years, just 384 petitions and 134 voluntary agreements materialized. Los Angeles County saw the largest volume at 511 petitions, with just 112 agreements or plans. Initial expectations were for 4,500 people in the first year, a staggering overestimation. Across California, courts are dismissing about 45% of petitions. San Francisco's dismissal rate is even higher, nearing 2/3. As for program completion, graduations are vanishingly rare. Los Angeles hasn't seen any. Of 9 counties with enough time to report completions, only a handful have had any. Lisa Uren, who helped introduce Care Court in Solano County, summed up frustrations. It's going much more slowly than we thought it would. The stakes go beyond policy. They're personal, especially for Newsom, who positioned Care Court as a solution to the twin crises of homelessness and insufficient mental health services. Still, state officials plead for patience, arguing that some counties, like Alameda with 125 petitions since December, are doing incredible work, and the program simply requires more time and support. However, many disability advocates and an increasing number of families are much less enthusiastic. Some, like activist Lex Stepling, dismiss the entire initiative as a costly political gesture. Others, like Anita Fisher, whose advocacy was once featured on 60 Minutes, now call the program a total failure after it didn't deliver for her son. She asks, after years of heartbreak and hope, why hasn't meaningful change arrived? So why isn't Care Court reaching more people? Several hurdles exist. Strict eligibility. Only those with schizophrenia or certain psychotic disorders qualify, leaving many suffering individuals out. Locating homeless petition subjects can be nearly impossible for outreach workers. Many simply refuse services, and Care Court lacks real power to enforce participation, even with judicial backing. To broaden Care Court, A bill backed by Senator Thomas Umberg could allow those with bipolar-related psychotic symptoms to qualify. But, and here's the controversy, the bill faces fierce opposition. Disability rights groups warn this expansion doesn't fix the lack of housing or proper mental health infrastructure, and that it simply widens the reach of an ineffective system. Supporters call the program a work in progress. Detractors call it a drain on resources. Who's right? Money is another hot-button issue. Between 2022 to 24, the state poured over $150 million into CareCourt. With fewer than 550 people helped, critics wonder if this is taxpayer money well spent, especially when some counties believe older, easier-to-access programs like assisted outpatient care were equally, maybe more effective. But do the numbers tell the whole story? Some experts argue that even in cases where petitions are dismissed, counties are connecting with people they never reached before. Michelle Doty Cabrera suggests, with anything coercive, the goal is to try to engage people out of their own free will. That kind of engagement might not make headlines, but could represent a subtler form of success that hasn't truly been captured. On the ground, stories are mixed. In San Diego County, massive preparation for an expected flood of cases led to hiring additional staff, but the surge never came. Petitioners, often overworked or overwhelmed, found the process too taxing. Some, like Tanya Fedak, filed petitions for their loved ones only to watch the cycle of homelessness and jail persist. There's no accountability, she says, and it's frustrating to see it go down, because my son is going to end up dead. Across counties, the process can be tough, even for the deeply personal cases. Federal privacy laws make proving eligibility difficult, and awareness of the program remains remarkably low. Nani Solano County's community town halls drew just a handful of people, and rarely the families of those most affected. Smaller counties often struggle with resources. Some have had no petitions filed at all, and a few refuse to disclose data, worried individuals could be identified. Will expanding CareCourt solve these problems? Not necessarily. Even among those rare few who make it into the pipeline, many petitions are dismissed. And a large percentage of those never receive additional mental health support. Changes proposed by Senator Umberg's bill might reduce some barriers, especially for those with criminal justice involvement. But critics fear it's just shuffling paperwork without increasing real care. And this is the part most people miss. According to outreach workers, slower growth in petitions might actually allow clinicians to spend more time building trust with each client, sometimes over months, before care begins. Rushing expansion without proper resources could easily undermine these delicate, essential relationships. In summary, CareCourt is both praised for its intent and fiercely criticized for its underwhelming impact. A lightning rod for debates on.